As a public health practitioner or physician, we are concerning about the improvement of health of the population by either health promotion or prevention of different health problem. In order to understand the prevention of diseases, it is important to know the natural history of disease. What are the stages of the development of the disease inside human, or the pathogenesis of the disease inside human? So after that, we are going to apply the appropriate preventive prevention method at the appropriate stage of the disease. So the natural history of the disease, it is defined or refers to the progression of the disease process inside the human body without any intervention. By intervention, we mean either by early intervention by screening, detection of the disease before its progression, and also it include also the treatment. So the process begins with the exposure or accumulation of factors which are capable of causing the disease. Exposure to the factors which may cause the disease, or risk factor, accumulation of risk factors such as either infectious factors such as microbes, different microbes, either bacterial or viral or fungal, or sometimes or due to environmental factors or air pollution or different factors accumulated in the body and will cause the or regarded as risk factor for occurrence of the disease. Without medical intervention, the disease process may end with either complete recovery, especially for some diseases which is called self-limiting disease, or incomplete recovery. That mean it progresses chronically and it become chronic diseases, and there are large number of chronic disorder. And also if sometimes the outcome end with disability or death. So the prevention and the natural history of the disease, we have already dealt in the previous lecture with the primary prevention and the different method of a primary prevention. We mentioned that it occurs before the occurrence of the disease and it prevent the development of the risk factor in order to prevent the disease. While the second stage of the disease, it is called there is a pathological changes in the tissue, but there is no sign and symptom, so it is called subclinical or preclinical phase, where there are pathological changes but the individual have no sign and symptom. And this is a very important stage where we can screen for the disease and prevent the progression of the disease for further stages, which is the clinical phase. So screening is appointed at the preclinical phase in order for early detection of the disease, and then we prevent the progression of the disease. So at this stage we are going to modify the prognosis of the disease by early intervention, such as appropriate treatment. What a doctor sees in the hospital or in the clinical does not represent the whole number of diseases, or it does not reflect the real morbidity rates of different diseases, because only severe cases they will come or consult a doctor at hospitals or at a clinic. So this number of patients who consult doctors, they are not reliable and they are not the real or actual situation of the disease. And there are large number of patients who do not consult a doctor, and although they need treatment but they do not consult a doctor, and there are large number of non-consulting health institutions. So the number of individuals who consulted health institution, it represent only the tip of the iceberg. The iceberg phenomena, it is a epidemiological phenomena which express the presence of large number of hidden diseases, non-undiagnosed diseases in the community. And these individuals, they are in need of the medical care, but unfortunately they are not consult the medical resources or medical institution for large number of causes. So it is our duty to detect and concern about these individuals who are, or what is called the hidden cases or hidden number of disease which are not diagnosed. And this is called the iceberg phenomenon. So from this diagram you can see the tip of the iceberg, which represent the proportion of people, sick people who consult the medical or utilize the medical institution, hospitals or clinics. While if you can see the hidden proportion of this represent the number of or the proportion of sick individual or disease individual, but they didn't utilize the healthcare services for different reasons. For example, some people they don't utilize the healthcare services because sometimes they use self medication or what is called the on counter medication, or they have financial barrier, so they cannot consult the medical institution or health institution, or they have organizational factors or barriers. Different hospitals have different organization and different policy for admission or consultation, or lack of the insurance. Many people they do not consult or do not use the health services because of the lack of insurance, and this regarded as an important barrier for not using the healthcare services, and other barriers such as transportation barrier, where the hospitals in a place where they cannot utilize because of lack of a transportation. And for elderly people, they are disabled, sometimes they have difficulty in or mobility movement in the movement, so mobility problems, so they cannot consult the healthcare services. So as a public health physician, it is important to concern about the hidden cases or the unrecognized cases, or those individuals who have no utilization for the healthcare services. Because of the clinical spectrum or cases of illness diagnosed by clinicians in the community often represent, as we mentioned, only the tip of the iceberg, and many additional individuals who they are asymptomatic but they didn't utilize the healthcare services. For the public health worker, as a public health physician, the challenge is that persons with undiagnosed infections or disease may nevertheless be able to transmit them to others, or maybe deteriorate or to further complication. So as a public health practitioner, we are concerning about the detection of subclinical cases, whether it is communicable diseases or non-communicable diseases, in order to apply suitable intervention in order to modify the prognosis or the progress of the disease. The search for unrecognized disease or diseases or defect by means of rapidly applied test or examination or other procedures in apparently healthy individuals. So, if we want to detect the unrecognized disease or problem, we can use a simple rapid test, either by examination, physical examination, or by laboratory examination, or there are different procedures for screening or for detection of the subclinical cases. For example, we can use physical examination for the screening of school children for hearing problem or for vision problem or for heart problem by just auscultation. So simple test can be used as a screening test, not necessarily that we are going to use a laboratory test. And laboratory tests, there are large number of simple tests which can be used for screening, such as for example, examination of a restaurant worker for typhoid, Salmonella typhi, which is regarded as the causative microorganism of typhoid fever. And some people, they are regarded as chronic carrier for Salmonella typhi, and they will excreted in the feces, and they can transmit the infection by using unwashed hands in preparing food, especially in the restaurant. So they will transmit the infection to others. So the restaurant worker, they should have periodic stool examination for detection of for the possibility of the presence of different microorganisms, not only typhoid fever or typhoid Salmonella typhi. So it is important as a physician to have early diagnosis in order to by using simple tests rather than when the patient progress to the late stage where he will need expensive laboratory test. So screening is considered one of the measures in the secondary prevention by early detection of the disease and the application of certain intervention to modify the prognosis of the disease by application of certain interventions. So by screening, it detects disease in its early asymptomatic phase before the appearance of the clinical sign and symptom, and then we are going to apply simple treatment, and this will lead to change in the prognosis of the disease and to prevent complication. So screening, it is a procedure which is used to screen people for disease or for risk factor which predict disease. And it is motivated by the potential benefit of the secondary prevention through early detection and treatment. So it is the process of using a test, as we mentioned, whether by physical examination or by a different laboratory test or physical examination on a large scale to identify the presence of a disease in apparently healthy people. They are apparently healthy people. They show no signs and symptoms in the subclinical stages. So screening is applied in the subclinical stages of the disease. Screening tests do not usually establish diagnosis. So this is very important point that the screening test is not a diagnostic test. If the individual show positive positive results in the screening test, we are going to refer him for establishment or confirmation of the diagnosis by performing another test. Since the test is done for individuals who are asymptomatic or apparently they have no disease, so it is important that we are going to use a test which is free of harm or harmless. And by screening also, it can be used to identify high exposure to risk factors. So the screening, it is not only screening for the disease, individuals who have or in the subclinical stage, but sometimes if they have risk factors, high, for example, high blood level of cholesterol, that means the individual is more likely to have hypercholesterolemia, and he have a risk factor for development of cardiovascular diseases or coronary heart diseases. So it is also important to look for certain risk factors. For example, screening for hearing impairment among individuals working in the airport where they are exposed to noises. One of the causes of hearing impairment among people is the exposure to noise. So, if they are exposed periodically or frequently to noise during their occupation, especially those who are working in places with the noises, such as in the airports or in the ships or in different types of occupation which have noise. So this will result in the impairment of hearing. So they should have periodic assessment for their hearing. Screening is a medical investigation carried out on apparently healthy people, as we mentioned, in order to first to sort those out, to sort out those who are likely to have a disease, who need further investigation ascertained by another or further test and start treatment. So first thing, we are going to sort or separate people who have the disease, who need treatment, and from those who are free from the disease, who are negative by the screening test. As we mentioned, screening test is not a diagnostic test, but if the individual show positive results, we are going to send for further investigation. So a screening test is achieved by the use of rapid test, such as examination or other procedures. So if we have a population, for example, if we want to screen the student, school children for hearing problem, so we are going to perform a physical examination by a doctor, and then he will assess the hearing, and then he will separate those who have negative values, or they are normal, they have normal hearing, so they don't need treatment. Okay, but if the test show positive, or if some children by physical examination show some problem in the hearing, so we are going to send them for further investigation, for example for audiogram, in order to confirm the diagnosis, and then we are going to start treatment. Screening is useful in the following aspects. First, in public health protection. If we have an epidemic, for example, such as the current time of COVID-19, if there is an individual who is positive for screened, and he is positive for COVID-19, so all the family or contact, they are screened for COVID-19 for their protection, and separate the patient from them, and then we are going to follow all the contact, or we trace all the contact. This is called contact tracing. We are going to make tracking for the contact in order to unseparate them, and until we see if they develop the disease or not. And as I mentioned previously, the screening for for restaurant worker for Salmonella typhi, which is really responsible for the occurrence of type or the causative microorganism for typhoid fever. Or for hepatitis B virus or HIV virus. So it is important. Oh, yeah, screening for the health worker for hepatitis B virus or HIV virus. The second use is direct contribution to the health of the individual. When a disease is discovered earlier in the patient, and we are going to send for further investigation if we have a confirmation of the disease. By further investigation we are going to establish a treatment. That means we have modified the prognosis of the disease, or we changed we prevent the complication of the disease, prevent the spread of the infection. So it is contributed to the health of the individual by changing the progression of the disease process. Or for research, data generated by screening can be used for research analysis. We perform many screening tests for research purpose. So the uses of screening can be classified into first case detection. Case detection first, which is called prescriptive screening. Case detection or prescriptive detection screening if you want to detect certain health problem. This is defined as a presumptive identification of unrecognized disease which does not arise from a patient request, such as in the neonatal screening. In the developed country, they always perform some investigation during the first week of life of the baby by taking taking blood by heel pricks, and they examine him for different health problem. One of these tests is what is called the Gedry test, which is tested for phenylketonuria. If the patient have phenylketonuria, so they modify the diet of the patient, so they prevent the occurrence or the progression of the disease. The second use is the control of the disease, as we mentioned, which is called the prospective screening. People are examined for the benefit of others in public health aspect, such as the prevention of the spread of infection, as we mentioned. In the developed country, they always screen the immigrant from infectious disease such as Ebola, tuberculosis, syphilis to protect the home population. Also, screening for AIDS and sexual transmitted diseases. Screening program may by leading to early diagnosis, permit more effective treatment, and reduce the spread of infectious disease and mortality. For research purpose, as we mentioned, to know the history of many chronic diseases like cancer, hypertension, and other diseases, screening may aid in obtaining more basic knowledge about the natural history of the disease. Initial screening provides a prevalence estimate, and subsequent screening provide an incidence figure. So at the research process, when we at the beginning of the research, if we make screening, so this will lead to the estimation of a prevalence of a disease. That means how many individuals have the disease. While if we have a follow-up research or a study, which we are going to discuss in the next lectures, this is called a prospective study, and then we are going to study the new cases or the incidence of the disease. The types of screening. First, mass screening. Sometimes we are going to perform mass screening to the whole population as a whole. For example, screening of children, as we mentioned, for visual problem or for hearing problem without selection of certain individuals. So all the population they are exposed for, or they are going to be screened for certain disease. For example, screening for tuberculosis, especially in endemic area, we are going to screen all the population for polio, for tuberculosis. The mass screening, it is applied or applying a screening test to a large unselected population. Everyone in the group is screened regardless of the probability of having the disease or the condition, such as we mentioned, the visual defects in school children or mammography in women. Mammography in women, it is one of the or the self breast examination in women, examination of the breast, especially in women. They are there are a large number of individuals who make the mammogram for all the women in order to early detect if there is any mass or any problem. Or colonoscopy for occult blood. Sometimes in many developed countries they make it routinely after the age of 50, the colonoscope and examination of the stool for occult blood in order for early detection of colon cancer. The other type is the high risk or selective or targeted screening. There are different names, but they are the same. That we are going to perform the screening test on the high groups who are at high risk. For example, if we have women with a positive history of positive family history of breast cancer, it is important to select them, and we are going to screen them periodically for early detection of any changes in the breast tissue. Or another example is screening the fetus for Down syndrome in mothers who already has a baby with Down syndrome. Screening for familial cancer, as we mentioned, for breast cancer or colon cancer, hypertension and diabetes, screening for cancer of the cervix in the low socioeconomic women or among women who are sexually active women, and which they are exposed for the sexually transmitted diseases. So it is important to have a periodic examination and test for human papilloma virus for early detection in the cervix if there is erosion, which is predisposing for cancer. Or screening for HIV virus in risk groups. Multi-purpose screening. Multi-purpose screening, that means the screening of a population by more than one test. More than one test done simultaneously to detect more than one disease. For example, that means we are going to performing many tests at the same time from one sample sometimes. For example, screening of a pregnant woman for venereal disease such as syphilis, for example, or HIV virus or hepatitis B virus by serological test. So we will have one sample of blood or serology, and then we are going to examine for many diseases. This is called multi-purpose. Many diseases from one sample at the same time. While multiphasic screening, the screening in which various diagnostic procedures are employed during the same screening program. We are going to screen, for example, for diabetes by fasting blood sugar or glucose tolerance test. Then we are going to take another for sickle cell anemia by CBC and CBC count and the hemoglobin electrophoresis. So this means multiphasic, we are going to screen different diagnostic procedure at the same time. The criteria for screening. Before initiating a screening program, a decision must be made whether it meet the all ethical, scientific, and financial justification. Always we should have a ethical consideration and scientific consideration and financial justification for performing the screening test. The screening was first established by Wilson and Junger in 1968. The criteria of a screening test is based on two considerations. When we want to perform screening program, we should take in consideration two things. First, the disease which we are going to screen for, and the screening test which we are going to use. For the disease characteristics, if we want to screen for certain disease, this disease should be a serious and relatively common problem. And the natural history is clearly understood. We should know the natural history of the disease, the stages of the development of the disease. And there should be acceptable, effective treatment available for that disease. If we don't have a treatment, there is no use of the early detection of the disease. So always it is important, we should be confident that there is, or we be sure that there is a treatment available for the treatment of the disease which we are going to screen for. The problem or the disease is an important public health problem. So it is important that we are going to screen for a disease which is regarded as a public health problem. Regarding the test characteristics, it should be acceptable to the population and easy to perform. The test should be acceptable. That means, for example, harmless, as we mentioned, because it is not we are going to screen the patient, which is not asked by the patient, but we want to screen for the detection of the disease. So it should be acceptable and it should be harmless. And it is easy to perform and relatively inexpensive, and it should be valid and reliable. And we are going to discuss this point later. Regarding the system, the health organization or the system characteristics, resources for the diagnosis should be available. As we mentioned, we should take in consideration the resources available in the institution regarding the availability of the diagnostic procedure, the material which are going to be used, and the treatment. As we mentioned, it should be available. So as we mentioned, the disease should be important health problem, high prevalence, such as in some developing countries, there is high prevalence of TB, so it is important to screen for that. Disease should have long and detectable preclinical stage. We should know the stages or the natural history of the disease, and it should have a preclinical stage where we can detect and intervene and change the series of the natural history. The natural history should be well understood, and appropriate tests must be available for early detection of diseases before the signs and symptoms appear. For tuberculosis, as we mentioned previously, it can be used by tuberculin test or by chest x-ray in order for early detection of the disease. Facilities must be available for the diagnosis of the disease for confirmation and standard. We mentioned the screening test, it is not a diagnostic test. And if the patient is screened positive by the screening test, so we are going to send him for further investigation and for confirmation of the diagnosis. So there should be a confirmation or what is called the gold standard test for the confirmation of the disease. Early detection of disease and the treatment should be able to reduce mortality and morbidity, and the disease should be treatable, as we mentioned, and the treatment should be available. Expected benefit must exceed the risk and cost. Always the benefit should be more than the risk. Regarding the screening test, it should be inexpensive, as we mentioned, financially acceptable and simple, easy to apply, acceptable by people, that means it is harmless, and valid, which we are going to discuss it in the next lecture, and reliable. Also, we are going to discuss. Simplicity, the test should be simple to perform, easy to interpret the result, and where possible, capable of use by paramedics and other personnel. So the test should be simple and easy to be used by paramedical staff, and it is easy to interpret the result. Many people, they make the screening, but they cannot read the result or cannot interpret the result. So it is important to be easy to perform and easy to interpret the result, and all the or most of those who are used for the screening, they should be able or capable of using this test. For example, a blood and urine test and ECG for early detection of hypertension. They are simple tests. Acceptable, it should be acceptable by the people. Since the participation in screening is voluntary, as we mentioned, because we are going to apply the screening on apparently healthy people, and the screening is voluntary, whether they want to or not. So if they want to, so the test must be acceptable to those undergoing it. In general tests that are painful or discomforting or embarrassing, they are not likely to be acceptable. So if the tests are harmful, or it may be painful or discomforting or embarrassing, sometimes some people, they are embarrassed to do the test, so they will not accept to have this or be involved in screening. So it should be acceptable by the people when it is harmless or painless, and it is not discomforting, and no, there is no embarrassment. Screening for example, screening for prostate cancer might not be acceptable to large proportion of the community because it is discomforting and painful and embarrassing. What is valid and reliable? We are going to discuss this in the next lecture, hopefully. But validity means accuracy of the test. How accurate the test in excluding the negative and and testing and they are right in labeling the individual as positive. So how accurate in diagnosing the disease or excluding the disease. While reliability is the precision of the test. How reliable is it? It means is it the same result on repetition? Does it give us the same result when we repeat the test? So, generally speaking, if it is, we mentioned that the screening test, it is not a diagnostic test. So, it is important to have the comparison between the two tests. For example, screening test done on apparently healthy individuals. As we mentioned, it is not come for it does not come on the for by the when the patient didn't ask about, or the individual, they didn't ask for this test. but it is for the health personnel. They want to screen those who have the disease and those who have no disease. While the diagnostic test it is done on the sick or ill individual. It is applied to groups. The screening test applies to groups, while the diagnostic test is applied on single patient. Screening test is not final, but if the patient is detected positive, so we are going to refer him for the confirmation of the diagnosis by performing further investigation. While the diagnostic test is final, the screening test based on one criteria of cutoff point. Always, we are going to discuss this in the next lecture. We will put a cutoff point for the readings, and accordingly we are going to label the individual positive or negative. While the diagnostic test, it is based on evaluation of a number of signs and symptoms and laboratory finding. The screening test less accurate and less expensive, while the diagnostic test is more accurate and more expensive. The screening test not a basis for treatment, as we mentioned. It is not confirmation of the test, but we need further investigation for establishment of the diagnosis and establishment of the appropriate treatment, while the diagnostic tests are used as a basis for the treatment. The screening test is the initiative comes from the investigator. As we mentioned, the individual, he is apparently healthy, so he didn't he is not coming for or asking for the test, while the individual or the investigators, what the health personnel, they are the individual who ask for people for to be involved in screening, while the diagnostic test is the initiative is from the patient himself, because he feels that he is ill and he need investigation in order to for the confirmation of the disease and for the startment of the treatment. And thank you.